All right, so now we're going to talk really quickly about the special tests for the knee. So the very first ones we're going to talk about are for the cruciate ligaments. So that's the anterior and posterior drawer of the knee. So before you begin doing any kind of testing, you always want to look for what we call posterior sag. So when we bend the knee, I'm going to have you bend both knees. We'll do them both at the same time. You want to kind of look at the shape that the tibia is creating. So usually there should be kind of like a little bit of a bump and like a roundness to it because you can see the tibial tuberosity that's jutting forward. On somebody who has a PCL tear, the tibia, which normally will sit like this, actually falls back. So it kind of looks like there's an indent or like a divot when you're looking at both of their knees. So he does not have a posterior sag, so his posterior sag test would be negative. So now that tells me, okay, I can go in and evaluate the ACL and the PCL, no problem. If the PCL was torn, then the tibia would sit here. So when I go to do an anterior drawer test, I'm basically causing translation, thinking, oh my gosh, the ACL is moving so much, but it's really just because the PCL is torn and it's sitting so far back. I'm pulling it back to where it should be, not pulling it further than it should go. So I'll get you to relax this leg. And I'm going to just show you on this one side. So again, you're always going to start on the non-injured side. I'm going to sit on their foot. My fingers back here just going to come underneath their hamstrings, and I'm trying to make sure that he's nice and relaxed. If they're contracted, this test doesn't work very well. So the thumbs are then going to come around, and I'm going to feel, this is the tibial tuberosity, and I should feel like an indent. This is the tibial plateau. Up here is where the femoral condyles are. So I'm going to go right into where those divots are. I'm going to put my thumbs here, and then I'm going to basically pull forward. And I'm going to translate the tibia anteriorly, because again, that's what the ACL is meant to prevent. It's supposed to prevent it from coming forward. So I'm going to pull forward, and then I'm going to be pushing back, and push forward and back. So the anterior drawer is the component where I'm pulling forward. Posterior drawer is where I push back. Okay? And you're just looking to see if there's any excessive amount of movement and translation going forward or going backward. Okay? And so a positive test for the anterior drawer would be excessive laxity and potentially pain. And that would be indicative of an ACL sprain or tear. And then again, same thing, if the tibia falls posteriorly and there's excessive laxity and some pain, then that could be indicative of a PCL sprain or tear. Okay, so posterior cruciate ligament and anterior cruciate ligaments. So those are the anterior and posterior drawer. The next one that we're going to do are for the collateral ligaments. So we have the valgus and varus stress test. So for the valgus and varus stress test, what I recommend doing is I'm going to get them to straighten out their leg. One hand is going to go on the outside of the knee. The other hand is going to go on the inside of the ankle. From here, I'm pretty much just doing a scissoring motion where I try to push the knee medially and pull the ankle laterally. So I'm going to do here and I'm going to push. And I like to really just get my elbow up into my hip, and then I kind of just lean forward with my hip, and I should just be doing a movement like this. I don't want to do a lot of bouncing. I'm just applying firm, easy pressure to see how far will that joint let me go. Eventually, I should feel something stopping me, which should be the medial collateral ligament. So that's called the valgus stress test. Okay. If there's excessive amount of movement and you can feel the bones shifting further apart than it should, then again, that would be excessive laxity. It would probably produce pain, and that would be indicative of an MCL, medial collateral ligament sprain or tear. Okay. For the varus stress test, I'm going to show you on the opposite side. What you're going to do is then put your hand on the medial side of the joint and lateral side of the ankle. I usually sit underneath when I do it, just like this, and then I do the same thing. I do literally the exact same movement where I'm doing a scissoring. Okay. And again, if you see excessive movement, so that would be indicative of some laxity, that will show you that the lateral collateral ligament of the knee is sprained or torn, sorry. And that's for the lateral collateral ligament of the knee. Okay. So that's your valgus and varus. So valgus is evaluating the medial collateral ligament. Varus is evaluating the lateral collateral ligament. Okay. The next one that we're going to do is called the McMurray's test. So this one is looking at the integrity of the meniscus. Okay. So what I'm going to do is you're going to be combining passive range of motion, flexion and extension, while doing internal and external tibial rotation. So pretty much every single thing you learned during your passive range of motion testing, you're going to utilize right now. So the first thing that I would recommend to make it simple is all you're going to do is externally rotate the foot. You're going to then bend the knee, have your hand shift once you're lifting, shift it to here. I'm going to bend them up. Then I'm going to come out, I'm going to internally rotate and out. And usually I do this back and forth and I go really, really quickly, and I'm doing kind of little like scoops. But for you guys, again, just focus more on the externally rotating the tibia, bending the knee, getting the heel all the way out, straightening it as much as you can, internally rotate, and then do the exact same thing. And just go back and forth with the internal and external tibial rotations while flexing and extending the knee. Okay? A positive test would be any kind of clicking, catching, grinding, or pain that you're feeling, especially right around the knee. You want to make sure it's right by where the meniscus would be, right on the tibial plateau, and that it's not coming from grinding of the patella. But if there's pain kind of deep inside and you can feel the clicking coming over where your fingers are on the meniscus, then you should be clear to assume that there's a meniscal tear. If I externally rotate the tibia and you feel clicking, catching, grinding, then it's more than likely a medial meniscal tear. If I internally rotate, then it's more than likely a lateral meniscal tear. And typically meniscal tears will happen either in deep flexion or extension. So really make sure you're getting to those end ranges to evaluate the entire integrity of the knee joint. Okay. The last ones are swelling tests. So for the swelling test, we're going to do the sweep test. So for sweep, you're going to brush up the medial side of the knee. You're going to do this about 3-4 times. Then you're going to put your hand on the outside. You're going to lift the other one and then push down the lateral side. What I'm trying to do is look for intracapsular swelling. So swelling that's not always super obvious, but I'm going to be pushing that swelling out, and then I'm going to try to push it back down. So if there is any fluid within the joint capsule, I'm moving it out of the way, and then I'm pushing it back. So what you'll see is usually a big bubble that'll kind of reappear on the inside of the knee. Okay, so that would be considered a positive test. On most people that you do it on today, like on Oscar here, as I do it, I don't see anything, so that would be a negative test. But again, positive would be like a balloon or fluid is filling this space right here once again, and that's called your sweep, and it's positive for intracapsular swelling. Okay. The next one is called the patellar tap or balancing patella, and this is where you're going to basically take the patella, you're going to grab with your index finger and your thumb, you're going to grab the two superior poles of the patella, and then you're going to grab the inferior poles with your other finger. I usually like to do my middle finger and my thumb down here. I'm going to stabilize the kneecap, and then I'm going to be pushing down. Okay. And on a normal knee, you're not going to feel much, but on somebody who has a swollen knee, what you should feel is similar to like if you took like a rubber duck and you tried to push it underwater, or like a ping pong ball and you tried to push it into a cup of water. The feeling of how it goes down but then immediately bounces back up, that's what you're feeling for this test. Okay, so that's what a positive test would feel like. Again, right now, as I do it, it doesn't feel like anything, just feels like I'm pushing bone on bone. That would be a negative test. Okay. The last swelling one is called the fluctuation test. This is where you use the webbing of both your hands. You put it on the bottom of the knee and the top, and you're basically pushing. And if there was fluid, you're imagining I'm moving the fluid from one hand to the other, and you're moving it back and forth. Again, right now, I'm really just pulling on his skin. So this is a negative test, but positive, again, would feel as if fluid is moving between your fingers.